Actually, I really always struggled with my weight from the time I was a child, but it really didn't ever begin to impact my life or my health until I was in my late 30s. I had married, just became a stepmother to a 5-year-old whose mother was deceased. And I just felt like I really couldn't. I started having trouble with my high blood pressure and things like that, and I just thought, I can't do that to this little girl, put her through the trauma of losing another mother because I wasn't taking good care of my health. And at that point, I had heard an ad on the radio from a man who had had bariatric surgery and had great success and was very happy with his result and his improved health. And so I just started doing some research online and calling different programs around the metro area. That was back in 2000. Not very many people were doing much bariatric surgery at that time, but finally settled on a decision, and it just seemed like every step of my journey I got a green light, and I just thought, I'll just keep going, and as long as I keep getting a green light and a thumbs up, I'll know that this was the right decision for me. And so my process was really very uneventful, without a lot of roadblocks. Went through the evaluation, got to surgery. I really had no difficulties. After surgery, everything went really well. I felt like I was really well prepared by the team I was working with, and lost about 145 pounds in the first year, and actually have managed to keep it off for the last 9 years. So I feel like I would do this again in a heartbeat if I had to maintain the health and quality of life that I've gotten from having weight loss surgery. Well, I think probably the best piece of guidance I got from the nurses that I was working with in my process getting ready for surgery was, if you don't take advantage of the first 6 months after surgery to really establish good, solid, healthy habits, then you've missed your window of opportunity to maximize your weight loss. And after a year out, after a gastric bypass in particular, your hunger returns. You can eat larger portions. So you really need to commit to developing new habits and new ways of eating in that early period after surgery, rather than challenging it by, oh, they told me I wasn't supposed to have pizza, but man, that went down without any trouble. Just because you can tolerate it doesn't mean it's the right decision. And so I don't know, I guess I was just ready. I had it in my head that that's what I was told to do, and that's what I needed to do. And I really do think I spent the first 6 to 12 months practicing new eating habits that were taught to me by my team. And so when my year came and my hunger returned and my appetite increased and my food volume increased, I still had good habits in place of not drinking with my meals, stopping when I was full, eating my protein portion of my meal first. All the ways we teach people to eat after bariatric procedure were just second nature to me by that point. My life is entirely different since I lost my weight. I used to be very sedentary, was a big avid movie watcher. I could tell you all the current movies that are out. I can't tell you when was the last time I went to a movie theater and sat through a movie, because I'm just so much more active. I skated rollerbladed Grandma's Inline Marathon about 2 years after my weight loss stabilized, and finished it, not in very good time, but I finished, and I sat across the finish line and said, okay, all you boys that made fun of me in high school, what are you doing when you're 40? I'm skating marathons. So that was a cool accomplishment. I don't ever need to do it again. In my experience working with other people who are going through this process and undertaking this life-changing operation, I think the saddest thing that I see and the biggest problem I see is the people who don't really understand their role in making it successful. I think people come in sometimes looking for a quick fix. They think, I'm going to have my surgery, I'll lose all my weight in a year, and I'll never have to think about it again. And there really is a huge component of personal accountability where people have to be willing to make good choices. I just think that having walked the walk and been in the shoes that patients are in brings a dimension that you can't really understand unless you've been there. And so just the personal experiences, understanding the social discrimination that people have gone through, understanding the fears that they have, and understanding the questions. I think, there are nurses that can be taught that, but having lived it certainly brings you a deeper understanding and compassion, I think, for what they're going through.